Story time. Gather around the campfire. Gonna tell a story. Thought I would tell my story of why I became a nurse. A long, long time ago in a galaxy far, far away, I used to be in retail. Then I moved on and was a certified athletic trainer for greater than a decade. And right at the end of that tenure, I got hurt. Injured enough that required overnight hospitalization for 2 days. At least 2 days. During those 2 days, I was cared for by nurses. Day 1, day 2, 2 separate nurses, Nurse A, Nurse B. During those 2 days, day 1 was a complete opposite of day 2, completely influenced by the nurse that was taking care of me. Ironically, I had been taken care of by a traditional female nurse. Yes, we're going to talk about it for a second. Traditional female nurse. And then on day 2, I was taken care of by a male nurse. So on day 1, taken care of by the traditional female nurse. I don't know what was wrong with her day, but she treated me like garbage. Every time I hit the call bell and the nurse's aide would call her into my room, she was flippant, she was put off by anything I needed, and at the time I was in a great deal of pain, and no matter what medication you gave me, it wasn't touching me, it was just torturing me. Apparently I was viewed as one of those patients, at least in hindsight I say that now. She made my life pretty miserable. All I could think about was getting out of the hospital. All I could think about was, I can't believe I'm actually here. I probably thought of some pretty nasty things to say about her. On day 2, fully prepared for another miserable day, was taken care of by, actually his name's Michael. I still remember his name because he influenced me so much. Michael took care of me, and anytime I had a need, even if he didn't have time, he'd poke his head in and give me at least a smile and say, hey, busy doing this, something I can do for you immediately, or can I come back? And he did that throughout the day because this was on a busy med-surg floor. I can't even imagine how many patients he was taking care of, on top of having an LPN and a nurse's aide. I honestly don't know. I'm just guessing here, spitballing. At the end of the shift, he came back around to do his afternoon rounds. Back then it was paper charting. He actually would sit in the room with me and talk with me. One thing led to another, started chewing his ear off, and I broached the subject of, how in the world did you become a nurse, dude? I mean, seriously? Nursing is for women, not for men, right? I mean, you really want to just clean poop and pass pills all day? Yep, I was one of them. I was exactly the person that I absolutely hate talking to. He was so nice, so genuine, and so attentive, even though he was probably so busy. Had a nice conversation with me and educated me, enlightened me on what nurses really do and what capabilities we have. And he talked about all the different places he had worked and all the things he had seen. I think at the time he might have mentioned his pay rate, talked about his hours worked and all the wonderful things. He truly loved his job. When I left that hospital, I was so genuinely and personally affected by what those 2 nurses did for me as a patient. Day 1 was miserable for me. Day 2 was awesome, or at least tolerable, yet my condition didn't change in any way. I was still having the same problems on day 1 that I I was still having the same problems on day 2 that I was having on day 1. I was still in the same amount of discomfort, same amount of pain. Medications were still not working. Yet, on day 2, it was not as bad. All because of Michael. All because of the impact he had on my life, on my day. He made me feel like he gave a shit. When I got home, I got on the internet and started looking up nursing programs in the area. And one thing led to another. 11, 12 years later, here I am. I ended up taking prereqs for nursing school. I ended up pressing forward and going through a diploma program or ADN program. Went through a diploma program, accelerated program, 18 months, in and out. Psst, there you go. I was an RN. Within the 2 to 3 years of that hospital visit, I was actually a nurse. 5 years later, got my BSN. 7.5 years later, got my master's, and I am now currently practicing as a nurse practitioner in the ICU. All because Michael gave a shit. And trying not to tear up here, but I really don't know where my life would be had Michael not given a shit about me. Nursing and the nursing profession has given me so much that I could dedicate an entire another video to what nursing has done for me. But none of that would have been possible had it not been for a nurse that took the time to show me they cared. He didn't do anything different from a skill perspective, from an intervention perspective. He didn't do anything different than that first nurse. His intention was different. He listened. He made time. And I know how difficult that is these days. Even if it was 5 minutes, he gave me 5 minutes. And he's the reason why I have been able to touch and impact so many lives. He's the reason why we have a tribe that's almost 6.5 thousand strong. Because he gave a shit. Nursing not only has given me an amazing career and introduced me to some amazing people and gotten to see places I would have never seen, things I would have never done, but it also introduced me to my wife, and it also led me to my current job and led me to be able to settle into the home of our dreams. All because of Michael. All because of that nurse impacting my life the way he did. So that's why I became a nurse. Why did you become a nurse? Leave your comment down below. And as always, check your own pulse first.